Unions have made a final plea for the Prime Minister Rishi Sunak to discuss higher pay settlements for workers in the NHS. That's as ambulance staff go on strike following industrial action by nurses. Well, joining us now is Bloomberg's Lizzy Burden. So, Lizzy, thank you so much for coming back on. I guess, the problem for Rishi Sunak is that he's refusing to commit to greater pay increases for NHS workers, and so they're striking.
Yeah, and really, he needs to step up from being the Chancellor to the Prime Minister, so people say, because in the history of strikes, what happens is you negotiate and then the strikers go away. You don't give them what they want, but you meet them somewhere in the middle. At least this is what the nurses are arguing. They say until there's a negotiation, they're going to keep putting strike dates in the diary. At the moment, they're saying if you don't negotiate this week, we're going to have strikes in January. And the risk for Rishi Sunak is that this carries on going all the way to 2024 and it dominates an election like it did in 1974.
This is not about the economics, so it's about politics. So how does he navigate this?
Well, I mean, he's just making economic arguments. So he was at the Parliamentary Liaison Committee yesterday. His argument is that inflation is public enemy number one, that fighting it is not just going to help the nurses, it will help everybody. And giving in to the unions is only going to add to the problem. Now, we saw in the public borrowing figures this morning, it's the highest on record for November, even higher because of the cost of servicing that debt because of high inflation and high interest rates. That in itself was a record. So the government's argument is if we pay the nurses more, it's going to add to the borrowing or take away funding for frontline services.
Yeah, but frontline services, I mean, striking is really a disaster, especially over Christmas.
Yeah, and it was already an issue before the strikes. We had long waiting lists here, but now this is dangerous. These are dangerous times. So you've got expectant mothers told that they're going to have to not have home births because the ambulances aren't there to take them to hospital. People with heart attacks and strokes may have to wait to get to the hospital, and people with falls may suffer big delays. Now, the government says it's the union's fault if people die. The unions say it's the government's fault if people die. We really are in a crisis moment.